Hello, everyone. My name is Tatiana, and I'm here with Dr. George Ampat, our medical consultant. And we want to thank you guys for joining us for a new episode of All About Aetrex Foot Health Q&A. Today's episode is on arthritis and diabetes, and it's actually our last live with Dr. George for our Foot Health series for Foot Health Awareness Month for the month of April. Dr. George, thank you for being here with us today. We are so happy for all the information that you've been giving us and teaching us. And let's just jump right to it and get started. Our topic is arthritis and diabetes today. And we are going to talk about what that ailments are, what are some common conditions, symptoms, what we can do to try to help relieve pain that is related to arthritis and diabetes. But before that, Dr. George, can you just tell everyone at home a little bit about yourself and about your research with Aetrex?
Thank you, Tatiana. Thank you for co-hosting along with me. Just wanted to give you a brief background as you asked. I'm originally from India. I did my medical schooling in India and then moved to UK about 30 years ago. I'm a consultant orthopedic surgeon and I work in Liverpool in the United Kingdom now. My main, though I do all of musculoskeletal health, my main interests are in spine and foot health. And though I have been operating for many years, I wanted to help people without surgical intervention. Surgery is good, but sometimes the difficulty with surgery is you can have complications and you may not get better. So we need to try to use all the non-operative methods before you finally commit to surgery. Surgery is an irreversible step. You cannot turn back. It's like, as I say, you can buy a house, you don't like it, you can sell it off to someone. But after you've had surgery, you can't sell it off to anyone else. You're stuck with that surgery. So before you commit to surgery, we need to exhaust all non-operative methods. So in that endeavor, I've been trying to find how I can help my patients, and that is how I came across Aetrex. And then I found that Aetrex products are very good for foot health. People, a lot of my patients who have plantar fasciitis, metatarsalgia, midfoot arthritis, they were helped by, and metatarsalgia were helped by Aetrex products. And then I got more and more interested into Aetrex. And then I started inquiring with Aetrex. And then they also recognized that there was some mutual relationship here. And now we are doing 3 research projects for Aetrex. I'll give you deal very briefly on those 3 research projects that we are doing. One is running and orthotics. Running is becoming very popular all over because one, running, you're going outside, it gives you the boost for your mental ability because you're sitting in an office working, you want in the evening to have a run outside. But unfortunately, running, there are novice runners, and novice runners are having injuries. Injuries is painful to the runner or the participant and also costing them, because they may not be able to go to work the next day. So how can we reduce their injuries? How can we make it more comfortable so that they are not running and actually hurting themselves? So one of the methods is using orthotics. By orthotic, you're preventing the pronation. So what we have done is, this is only a pilot study. We have taken 100 runners and 50 we are giving them orthotics, 50 we are not giving them orthotics, and then comparing the difference between the two and seeing whether there is more injuries in the one group or the other, or whether there is increased comfort in one group over the other. So that is one research we are doing. The second research we are doing is on orthotics and plantar fasciitis. Plantar fasciitis is when you have pain in the heel. It is usually, the first step is usually very painful. As you get out of bed and put your feet in the ground, it is very painful. It's on the heel. So usually orthotics are helpful, and there's a lot of research evidence to support that. But unfortunately, it does not always successful. So why is it not always successful? Is there something else in addition we could do to make the orthotic treatment successful? So orthotics can only be worn when you wear shoes, and it can't be worn when you're not wearing shoes. And you are limited to when you go to work, and when you're in office, then you can wear shoes and you can wear the orthotic. What do you do when you're at home? Because you may not be wearing your shoe. So that is why we thought, why not we try the flips? Flips are one of the orthotic products available from Aetrex. So during the day, while they are at home or early in the morning or in the evening, they can wear the flips. And during the day when they are at work, they can wear the orthotics, thereby increasing the total time that the foot is protected by the orthotic support. So we're looking at whether just flips alone plus the orthotics. Then the third research we are doing is in seniors. Now, as I explained to you, foot pain is a major issue. 1 in 4 adults get foot pain. And when you have foot pain, your immediate reaction, whenever you have pain, the immediate reaction is not to move that body part. So if you have pain in your foot, the immediate reaction is not to move, not to exercise, not to walk. But that has a significant effect on your general health, because if you don't walk, your heart becomes weak, your lungs become weak. So you need to walk, you need to exercise. So as we grow older, we are getting into frailty, where our muscles become weak, we fall and break our bones. We should not allow that to happen. So as we said, there is a saying, medicine has increased life, added years to life, but is there life in those years? So maybe just because we are living up to 80 years doesn't mean that there is life in those extra 20 years. 100 years ago, our life expectancy was 60. Now life expectancy is 80. Yes, 20 years has been added. But if the 20 years is years of disability, then it is no good. So what we want people to be active, should be able to enjoy life. So the orthotics provide greater support, less pain in the feet, and potentially they can become more active. And that may also, because of the increased surface area that is in contact, they'll also decrease falls. Because falls is dependent, your ability to balance is dependent on your eyes, your vision, dependent on mechanism inside your inner ear. There are semicircular canals, and also the sensory input from our feet and from the different joints in our body. By having an orthotic increases, because otherwise if you don't use an orthotic and you're walking on, say, hard floor, or even in a shoe which is flat inside, you're only putting weight through your great toe, at the metatarsal head, the little toe where at the ball of the foot, and on the heel. That is not enough. But when you use an orthotic, there is a wider area of contact, and when there is a wider area of contact, the entire skin surface which is in contact with the orthotic sends impulses to the brain, and the foot is able to understand where the foot is and positions the next foot appropriately. So that thereby it increases balance and decreases the chance of falls. So that is what we are trying to do, whether in seniors, whether this will decrease falls, increase their confidence, and also decrease their pain in different musculoskeletal parts. That's the 3 forms of research. Thank you.
Thank you for sharing all that information, Dr. George. And we're excited to hear how the research goes and what we learned from all these research projects. So now we're going to talk about arthritis and diabetes. So for those who are suffering from this condition, or we think you may have it, we actually have want to know, what are some common foot ailments that people who have arthritis and diabetes, what are those things, Dr. George? What are some symptoms? What are some treatments? What can help? What does it feel like?
Good. So let's start with diabetes. Diabetes is not a particular problem with the feet itself. Diabetic is a general problem where insulin is less. So let's go back to insulin. What does insulin do? So insulin is necessary to transfer the glucose from the blood into the cell. It is like our petrol pumps in our petrol stations. Now, petrol or gasoline is there in the petrol or gasoline stations, but it needs to enter our car for us to drive the car. For the petrol or gasoline to enter from the petrol station into a car, we need pumps, and they can be connected to the car, and petrol or gasoline can be pumped into the car. Now, that is exactly what insulin does. Though we eat, the food becomes glucose by our intestines and the enzymes in the intestine acting on it. But once the glucose enters the blood, it cannot enter quite a lot of the cells unless there is insulin. Now, unfortunately, there are 2 types of diabetes. There is type 1 diabetes and type 2 diabetes. In type 1 diabetes usually occurs at a very young age. Actually, there is our warrior cells kill off the cells that make insulin, and that is why patients with type 1 diabetes do not have any insulin. Whereas type 2 diabetes is slightly different. It is slightly occurs in the older age group beyond the age of 30 or 40, and there may be 2 reasons. One, maybe we are too large and we need greater amounts of insulin, and we are not able to produce that amount of insulin, and that is why you have diabetes. In addition, there is also something called the insulin resistance. Say, for instance, you have a pump, but if the gasoline pump in the tank is closed, even if you try to pump it, the petrol is not going to enter into the car. So something like that. Though there is insulin, it is not able to transport the glucose through the cell wall into the cell, and that is insulin resistance. So this is what happens in type 2 diabetes. In type 2 diabetes, as I said, it is a systemic problem. They may have problems with the eye, they may have problems with the kidney, they may have increased rates of heart attacks, but we will try to limit ourselves to what is happening in the feet. In the feet, the main effect is because the damage to the nerves and to the blood vessels. So if you look on this diagram that is projected up, on the top is you can see the blood vessel, and you can see that the small blood vessels, the blood vessels are tubes that are taking blood to the different parts of the body. So our skin needs blood, our toes need blood, our foot needs blood. Now that blood is getting clogged, and that is where you're seeing on the top. Number two, the nerves stop functioning. Now, when the nerves stop functioning, the foot becomes numb. And that is when we say we have neuropathy. The longer the nerves, the greater the chance of neuropathy. The longest nerves are the nerves that reach the foot and ankle because they are farther away from the head. And that is why you have increased chance of developing neuropathy in the feet. Now, you would think that is a good thing if I don't have pain in the feet. But actually, pain is a protective reflex. Pain is a blessing. Pain is not a curse. Pain is a blessing because pain prevents us from injuring ourselves. Now, when someone who has diabetes and someone has neuropathy, what happens is they get small wounds or blisters. And when they have these small wounds or blisters, they ignore it because it is not painful. And when they ignore it, the same wound becomes bigger and becomes an ulcer. Slowly, it will take away the soft tissue, it may become deeper, and then may involve the bone. If it involves the bone and the infection reaches the bone, then the patient may require an amputation. Unfortunately, this is not good. So, about one in six patients who have ulcer will have an amputation within 6 years. And unfortunately, after an amputation, there is further deterioration. There is research to show that if you have an amputation, there is an increased chance of death. So after an amputation, there is some evidence to show that one in six of them will die in 6 years' time. So it is, the effect is compounded. But the clever thing is to avoid having an ulcer. How can you avoid having an ulcer? So let us look back at how the normal foot, and I explained to you there are three areas in the foot that have increased pressure when we walk. The next one, yeah, there are three areas. So one is underneath in the ball of the foot, just where the great toe meets the ball. The other is where the little toe meets the ball of the foot, and the last is on the heel. So these three areas marked in red here are the areas where there is maximum pressure. That is because our feet have arches, and it is that where the arches touch the floor that there is the greatest pressure. Now, unfortunately, because there is great pressure there, it is likely that one develops ulcer in these areas. So, how can we decrease the pressure in these areas? The simple answer is we need to put an orthotic. I have put an orthotic in this image. I don't know whether you can see, it's a light gray coloring around. But as soon as you put the orthotic, the pressure in those three areas gets decreased, and the pressure is evenly distributed as shown in this next slide shown here. The pressure is evenly distributed because now you have an arch support, and quite a lot of the weight goes through the arch and through the rest of the feet and the heel cup at the back. So there is no increased pressure at the three areas where we were experiencing increased pressure. So orthotic is a simple way of evening out the pressure and preventing from ulcer from developing. Research has shown that one, it decreases ulcer formation, and number two, it also decreases reoccurrence of ulcer. It is likely that someone who has an ulcer may get development for ulcer further, but having an orthotic prevents that. So an orthotic is a simple measure. But if you have already developed an ulcer, then it is important that you're seeking help from a doctor or health professional. And important is for you to identify whether you have neuropathy or not, and to see whether there is any cracks or any wounds underneath your feet, because if you're numb, you're not going to notice that. So keeping a mirror on the floor and having inspecting the undersurface or the sole of the foot is very important. or asking a relative to touch all the toes while you're not looking at it. And if they just lightly touch the toes, you should be able to feel it. But if you're not able to feel it, you might have developed neuropathy. These are the things that we can do to identify whether you have developed neuropathy in the foot. So that is on diabetes. Now let us move on to arthritis. Now, again, there are many reasons for arthritis, but the two main types of arthritis are osteoarthritis or wear and tear arthritis, and the second is autoimmune arthritis. Osteoarthritis is mainly a mechanical problem, and it occurs from either a previous injury or wrong weight bearing, and that is why you develop osteoarthritis. It may not just be the weight bearing, it may be because our lack of muscle support. So muscles, strong muscles prevent osteoarthritis. So here in this, I've shown you three areas where arthritis is more severe. The second type of arthritis is autoimmune arthritis. And autoimmune arthritis is like rheumatoid arthritis or psoriatic arthritis or ankylosing spondylitis. In these situations, actually it is not the wear and tear, but the warrior cells in the body which is fighting with the joints. We do not know why, but it's like friendly fire. It's like the army, the soldiers fighting against their own country soldiers. So that is what happens, autoimmune arthritis. So now there are medications to try to suppress those warrior cells from attacking the joints. And as I explained, one in the ankle, you can see there is a main leg bone, that is the tibia and fibula. Where it meets the foot is the ankle joint. That is usually osteoarthritis from previous ankle fractures. At the great toe, at the ball of the foot, you may have gout, or from bunion, you may develop arthritis there. The third is the midfoot. So where the talonavicular or in the cuneiforms, you may develop arthritis, and there is the rubbing of the bone, the cartilage goes off, and raw bone rubs on raw bone, and that is how you develop osteoarthritis in that area. Now, when you have arthritis, as I explained to you, the cartilage is lost. And when the cartilage is lost, the raw bone is rubbing on raw bone. So you need to try to avoid that rubbing. As we normally walk, there are about 28 bones in the feet and they rub against each other. To prevent that rubbing, if you use a contoured surface, so all the solution that you need is a little arch support underneath your foot. As in the next illustration, you can see I put an arch support in blue, and as soon as you have that arch support, then there is a cradling of the foot and there is less friction or less wear and tear between the joint surfaces. So the simple solution to early osteoarthritis is using an orthotic. And there are different types of orthotics that are available in Aetrex, and they are value for money. You don't need to spend a lot of money getting a customized orthotic. These prefabricated orthotics, and there are different series and different options in different series which are available. And I'm sure Tatiana will show us the different options and some of the orthotics. Thank you.
Thank you, Dr. George, for all the information. It's so useful to see, the graphics with your eyes, understanding where those points are, the pressure points, and just learning how the orthotics help and can help relieve pain. Thank you, Dr. George. And we also asked our viewers at home to submit some questions related to arthritis and diabetes. So the first question we received is from Lisa P. She says, "Hi, Dr. George. I'm a diabetic and sometimes get a tingling in my feet. It happens randomly, but I've noticed it is happening more frequently now. Could this be neuropathy?"
Thank you, Lisa, for the question. Very valid question. Yes, potentially it could be neuropathy, but don't be unnecessarily worried. Neuropathy occurs in only as a long-term complication. As soon as you get diagnosed with diabetes, you are not unlikely to have neuropathy. You need to have long years of uncontrolled diabetes for you to develop neuropathy. But it is important. So I do not know exactly how long you've been having diabetes, and also you should need to have uncontrolled diabetes. If your diabetes is under well control, then it's unlikely this is neuropathy, because all of us sometimes have tingling in the feet, and it would be wrong for you to unnecessarily get worried about it. So let's see whether you have normal sensation. One of the things you could ask is you turn your head away and ask your partner or your friend to lightly touch the toes of your, each of your foot, and see whether you can recognize it. When they touch lightly, and if you recognize it, then you don't have neuropathy. But if you can't recognize it, then you have neuropathy. But when you go to a doctor, they have different things called the Semmelweis filament, where they can actually, with precisely, they can give a pressure on your foot and see whether that you're losing your sensation or not. So I wouldn't be unnecessarily worried, but there is no harm if you're having early stages of neuropathy to use an orthotic to see that there is no development of ulcer.
Yes. Thank you, Dr. George. Our next question is from Janice R. She says, I'm a dancer with arthritis in my feet. I have high arches, drop metatarsal, and toe pain. I have a lot of pain in my metatarsals when I'm on my feet dancing. Is there anything I can do?
Thank you, Janice. Again, a very, very good question. Now, yes, if you have arthritis in your feet and you are describing a complex problem, because you have high arches, you have a dropped metatarsal, and that indirectly is causing metatarsalgia or pain in your toes. Now, yes, you can be helped with orthotics. Now, I would recommend that if you're using orthotics, you try one of the Aetrex, the 2300 or the premium memory foam orthotic. That would be most ideal for you. But if you have a complex problem, you may also want to see a doctor and get yourself properly diagnosed, because I don't want to give you the wrong information. But if it is not a major problem and you want to try the orthotics, this would be my suggestion, either the 2200 or the 2300. And I think Tatiana will be showing us both those orthotics this evening, and that will give us some information how it cradles the foot. I advise all my patients who have diabetes and who have arthritis the 2300 and the 2200. Thank you.
Thanks, Dr. George. Our next question is from Sybil B. She says, I've been diagnosed with talonavicular arthritis of the hind foot. When I walk, hike, or exercise, the pain radiates up my ankle. Can you recommend an orthotic or treatment that can help?
Thank you, Sybil. Thank you for this very valid question. This is the foot. I don't know whether all of you can see it. So
Yes.
here is the leg bone or the tibia, and this is the this is the center bone of the talus, and the bone in front of the talus here is the navicular. So basically, there is arthritis where I'm opening up in that joint here. That is where you have arthritis. Now, as you walk, you can notice that there is a collapse of the arch and it will irritate that joint there. So the easiest way to solve that is to use an orthotic. And by using an orthotic, you're cradling your foot. And I always give an example or a metaphor for people to understand. Imagine you're walking on a sandy beach, and imagine you're walking on a hard rocky surface or a tiled floor. Now, when you walk on a sandy beach, the sand, you are creating a footprint. When you create a footprint, you don't notice the pain because the weight is distributed over a wider area. Whereas if you're walking on a hard surface, on a stony surface or a concreted floor, then the points of contact are much less, and then it is becoming painful. If you're able to cut off that little piece of earth or sand in the beach and put it inside your shoe forever, it would be so comfortable. And that is exactly what the orthotic does. The orthotic recreates nature inside your feet, and that is the type of surface that we need to be walking. We were, apes, and as apes, we descended from the tree to the ground. And when we descended, nature made us to walk on sand or grass. But as soon as we invented the wheel, we decided that the wheel was more important. That's why we made all the surfaces very hard. So the surfaces are more suitable for the wheel than our feet, the hard surfaces. But I know our feet are so good, it can bear with these hard surfaces. But we want to recreate. For some people who have pain, it may be better to use the orthotic to take away that pain and to give increased comfort. Thank you.
Thank you, Dr. George. And our last question is from Josh E. He asks, is walking good for arthritis in the feet? I enjoy going on 1 to 2 mile walks every day, but have recently been diagnosed with arthritis.
So I presume you have arthritis in the feet. It's possible you may have arthritis elsewhere. In general, exercise is useful for any form of arthritis. Because why exercise is useful, let me give another metaphor. We can stand, but we are able to stand not just because of a bone and joints, but because of the muscles attached to the bone and joints. If I stripped someone of all the muscles, they would be a sack of skin with bones inside. It is the muscles that hold us up. Now let's look at the car for another metaphor. Now in the car, my tires need to be plumped. They need to be filled up with air. If they are filled up with air, the car goes well and there is no increased stress to the shock absorber. But unfortunately, the tires are not inflated. The tires are half filled. The car wobbles a lot. And if the car wobbles a lot, there is an increased stress onto the shock absorber and they may get damaged. So same way in our body, if our muscles are not strong, there is an increased wobbliness in the joint and there will be wear and tear in the joint and there'll be arthritis in the joint. So to prevent that wobbliness or the abnormal motion of the joint, you need to keep the muscles strong. And that is how exercise helps. Now, I can understand if you have arthritis in the feet, you may need to have some decrease of pain before you're able to walk. So I suggest you wear an orthotic. And I do not know how old you are, Josh, but generally for my senior patients who are 60 and above, who have arthritis in their feet, my first suggestion is to wear the 2200 or the 2300, and that gives them the adequate support and they're able to walk. And walking is good. I encourage you to walk every day, and maybe using this orthotics will allow you to get that pain-free walk every day. Thank you.
Thank you, Dr. George. So everyone at home, thank you for submitting your questions. We hope all this medical information is very, very useful. But we do want to recommend that you do see a physician or a doctor if you are experiencing foot pain. We also have a Albert 2 Pro scanner here. We have our scanners all over the world, and our scanners are amazing because they can measure your feet and they tell you all this great information about your feet. It can tell you about your length, your width, your pressure points. So I'm gonna go get my feet scanned right now. So I'll see you guys by the scanner. Okay, so this is the Albert 2 Pro scanner. So as you can see right here, these are 4 RealSense 3D cameras. And underneath the scanner are over 5,000 pressure sensors. So the way it works is you just stand on the scanner. You want to make sure your pants are rolled up, and then we can begin our scan. And we have to stand still. And in just a few seconds, the Albert 2 Pro is capturing our instep, arch height, girth, length, width. So it's obtaining the pressure under our feet, and it's going to recommend the best orthotics for my specific foot scan. Okay, so as you can see here, I have a lot of pressure in my forefoot and in my heels. And you can also email the scan to yourself, which is amazing. You can always have it there. You can always check in on it. So these red areas, a little bit of that orange, that is where I have a lot of pressure in my feet. And on the left, you can see my profile. It has my arch type, length, width, instep, arch height, girth, and my shoe size. So if we click on orthotics, the scan is recommending the best orthotics based on my scan. And it is recommending the L2300 Premium Memory Foam Orthotics. So the pressure map on top is showing what my scan is without orthotics. But as you can see on the bottom, all that redness has gone away. This is what my scan would look like if I were to put these orthotics on right now. And what these orthotics are doing, they're actually helping to offset pressure, and they're preventing my plantar fascias from stretching. And then also, if you click on the 3D measurements, this is what the camera has obtained. This is a measurement of my feet, and it's really cool. You can really see every detail of my feet. And again, it's just helping us understand exactly our measurements of our feet. And we have scanners all over the US. We have a store locator, so definitely check it out, guys. It's free. It only takes a couple seconds. It's the only place we can get all this great information quickly. Okay, so I'm going to go show you guys the footwear as well. I'm going to go back to the shelf. Hello, and I hope you guys are interested in trying out the scanner. So find a scanner near you. But we are going to go into the products. So this is the first product we want to show. This is the L200 Conform Orthotics. They are $59.95 and they come in women's and men's sizes. In women's sizes 4 through 13 and men's sizes 6 through 16. And these insoles are recommended for those with low risk diabetes. They have arch support built in right here. And they also have a plastizoid top cover that customizes to your foot to help relieve pressure. It has a molded cork blended core bottom that helps provide superior resilience and shock absorption. That is an amazing feature. And it really helps with arthritis, rheumatoid arthritis. We've been getting a lot of customer reviews saying that this really helps them. So this is how our orthotics work. So a lot of shoes come with a removable insole inside, like these do. And as you can see, these do not have any support. They're very flimsy. They are not supportive. But if you compare it with an Aetrex orthotic, you'll see how supportive an Aetrex orthotic is. So you just remove the insole out of your shoe, and then you insert them into your shoes, the Aetrex ones. And that's it. That's how simple it is. And that is how you insert Aetrex orthotics into your shoes. So you can really make any shoe as comfortable as an Aetrex shoe. And these orthotics, they also do not come in half sizes. They come in full sizes only. So if you are a half size, we recommend going a half size smaller because that'll just give you a little bit more room inside your shoe, make it more comfy. This is the Conform. They're $59.95. The next style we have is the L2200 Memory Foam Orthotics. They are $74.95 and they have arch support built in right here. And these orthotics, you know, the cushioning is in the name. They're memory foam. They have a layer of memory foam that really feels like you're walking on clouds, like you're walking on air. They come in women's sizes 5 through 13 and men's sizes 7 through 15. And these orthotics are great for those who are on their feet all day. You know, if you're a nurse, a doctor, a chef, if you work in the postal service, you're just walking a lot. This is great because you get that extra cushioning with the memory foam. And we've also received reviews that those who have arthritis, they're diabetic, they find a lot of comfort with these orthotics and that they're actually better than their custom-made orthotics that are very expensive. So we definitely recommend trying out the memory foam orthotics. And then we also have another pair. These are our premium memory foam orthotics. So these are $79.95. And the difference between these orthotics and the other memory foam ones is that these have 43% more cushioning in the forefoot area. And they come in women's sizes 5 through 13 and men's sizes 7 through 15. And, you know, just like the reviews for the other styles that we showed you, these have been helpful for those who have arthritis and diabetes. Dr. George, do you want to just share anything about the memory foam?
As I was saying earlier, the memory foam is ideal for people with diabetes and arthritis because of the fact that it cradles the foot and evens out the pressure. And evening out the pressure is very important. Another thing about the scans, which Tatiana showed us earlier, we rarely do get scans of our feet. Now, what we must understand is our feet serve us very well. Our car tires, we align and balance them when we change our car tires. Our car tires only travel about 20,000 miles in its lifetime, but our feet travel about 110,000 miles in a lifetime, or rather, our feet take us 4 times around the globe in our lifetime. Why don't we balance and align our feet just like how we align our car tires. I can't understand. Is it only because our feet came free and the car tires are $50 or $60? Now our feet are much more costly. It didn't come free. It is a priceless, possession, and we need to take care of our feet. So scanning the feet helps us to understand what the foot looks like and potentially provide us with the right orthotic so that it can cushion and cradle the foot to prevent potential problems, and also to increase the mileage. If I have a good tire, I can go longer in my car. Similarly, if I have good footbed, then obviously I can walk longer, I can run longer, and that is makes me more healthier. So it is a simple way to have a pain-free increase walking or increase miles for our walking. Thank you.
Thank you, Dr. George. Yeah, guys, so the memory foam, and definitely take care of your feet. These orthotics, they're affordable. They can make any shoe as comfortable as an Aetrex shoe. You can just get comfort, whatever shoes you guys like, and just insert Aetrex orthotics. We also have free shipping for the month of April. So there's only a couple days left. So make sure you guys take advantage of it. Mother's Day is also coming up. So these are great gifts to give, are the orthotics. We also have a great return policy. It's 30 days, our comfort health guarantee. So definitely take advantage of it. The next style we have is the Jillian Sport Sandal. Listen, if you guys know Aetrex, you know the Jillian. It is our best-selling sandal year after year. It comes in a lot of colors. It has arch support built into the footbed. It has memory foam cushioning throughout the footbed. As Dr. George was saying, the memory foam is very comfortable. This is great. This shoe comes with memory foam. They have a bunion pocket here. So these strategically placed straps here help relieve pressure from the bunion area. And they also have a padded collar and adjustable straps here for the perfect fit. I know those who, in the summertime, if your feet swell up, this is great. You can always accommodate your feet how they are throughout the day. They come in a bunch of different colors. They come in sizes 5 through 11 and half sizes. This is the Jillian in white. They look so nice and they're comfortable. They're healthy for your feet. And they have so many different colors online, so make sure you check them out. This is the red. This is a new color we just launched a couple months ago. So check them out, guys, aetrex.com. And if you haven't already, sign up for our emails and text messages because you'll be the first to know about back in stock items, new launches, sales. And you can also sign up for our loyalty program because the more you spend, the more points you get, and the more you can save on beautiful shoes and beautiful supportive orthotics. The next style we have is the Express Runner 2. So these are $99.95 and they come in women's sizes only. These sneakers have a removable insole that actually has a memory foam top cover, which is very supportive. And they have a metatarsal pad. I know it's kind of hard to see on screen, but it's right here. This metatarsal pad helps relieve pressure from the ball of foot and forefoot area. So this comes with a pair of Express sneakers, but you can always replace these if you guys want the Conform, if you want the memory foam, you can definitely do that. They just slip right in. Along with the Express, they have a padded heel here, a padded tongue. They have adjustable laces to help you get the perfect fit. And they also have this rubber outsole with this design here that helps relieve pressure from the heel area. And they also have a TPU external heel counter here. This helps support your heel. And the Express comes in lots of colors. Check them out online. Comes in white, black, pink, and gray. And they're only $99.95. And they also come in a wide width option. And we've had reviews from customers saying that this actually helps them. They're like the most comfortable shoes that they own. It really helps to relieve their arthritis, just helps keep them comfortable all day long. And they're able to go all day. They're able to get those extra steps in, extra walks and comfort with the Express Runner 2. And the next style we have is the Berry's Helen Mary Jane. They are $114.95. They have arch support built into this removable insole. It's the arch support. And that comes with a pair of these Berry's Helen Mary Janes. And again, you can also replace the insole if you want the conform, if you want the memory foam. These shoes are made with a stretchy knit that is very comfortable and supportive. They have this adjustable strap to help accommodate different feet. They have a rubber outsole. And they also come in our standard width, they come in wide width, and they come in extra wide width. So it's very accommodating. We hope a lot of people can find comfort with these. And they come in sizes 5 through 13, and they come in half sizes. And again, we've had reviews of people who have arthritis, they have deformed toes. This helps, the stretchy knit really helps them, and they find comfort with the Berry's Helen Mary Janes. And that concludes our live for today and the end to our series here with Dr. George for our All About Aetrex Foot Health Q&A. Dr. George, thank you times a million. Thank you for always being here with us and for helping everyone learn more about their feet and how important proper foot health is.
Thank you very much, Tatiana. You hosted it very well, and I thank all the other viewers who were at home and hope our advice was useful to them. Thank you and have a lovely weekend.
Thank you, Dr. George, and thank you everyone for joining. And again, if you are experiencing foot pain, make sure you do see a physician. Thank you guys. Bye. Have a great weekend.
Bye.